name is Pauline Long, and I am the social media and communication consultant with Sisters Saving Ourselves Now, Pittsburgh Black Women's Roundtable. And we're here at the Black Women's Economic and Health Symposium. We're giving presentations on how we can improve the economics and advocacy efforts of Black women in Pittsburgh, especially since a study was done over the last couple of years saying that the worst place for Black women to live is in Pittsburgh, PA. I'm here with another doctor, and her name is?
My name is Dr. Anita Edwards. I am an internist and presently employed by Highmark Whole Care, but I am also the treasurer and program chair for Gateway Medical Society, a component of the National Medical Association.
And this program that we're here today is sponsored by Gateway Medical Association in conjunction with Sisters Saving Ourselves Now and several other sponsors like UPMC, etc. And Heinz Foundation, and we want to give special thanks to them. But I'd like to ask you a question or two about what is your takeaway today from some of the presentations that have been made?
Well, I think the takeaway here is that we understand, especially from Gateway's side, that for us to improve people's health, that we have to also address other social determinants of health. So with that, we realize that we need to address their housing, transportation, food insecurities, and things like that so that we can help people have better lives.
And I'm so excited about this program today. When you made your presentation, it was on the spirituality issues and concerns that we have to do to make things better for ourselves and for our children. And is there something that you didn't get to say in your presentation that you may want to add right now?
I don't know if I didn't get to say anything, but I just like to reiterate that I think it is so important that we as Black people get back to our spirituality in the church and in our community. I think that's something that we have lost. As we have diversed ourselves throughout, we are losing that ability to help each other. And if we don't learn to advocate for ourselves and not wait for other people, we'll never succeed. So that's what this is all about. You know, I don't even believe in subjugation, but I do think that maybe what helped at that particular time is everyone had to band together. And we need to have that same attitude now. We need to just be able to band with our brother and sister and be each other's keeper.
And I like what you just said about that. You know, years ago, my late husband said that integration was an experiment, didn't work. And what he meant by that is when we were allowed to move to other places, we broke up our community. And so what I think I hear what you're saying is that we need to find a way to reach out either through our church, through our activities, to build this community and socialization again. That's what I hear you saying?
That's what you hear me saying. I think, we need to take ours back and not let other people steal it from us, but to take it back and to make it out. If we were proud of our own stuff, then other people would not be able to destroy it. We give it the value. So if I love where I live, I'll take care of it and I'll make it beautiful, and then other people will want it. So we need to get back to home.
One last question. I know I didn't tell you about this in advance, but you did say something about community. Community, again, in the zip codes. And where you live, if you have a car and you have a zip code, you can just about go and do whatever you want to do. Put your kids in private school, go to the grocery store, go to the doctors. But if you live in a community and you don't have a car, tell me again, what are some of those problems?
Well, if you don't have a car and you live in a certain zip code, especially here in Pittsburgh, and the one I used was my own, which is 15221, we realized there's very few grocery stores in that zip code, if any. There's very few of any pharmacies. There's not any physicians in that area. There's no hospitals in that area. The schools, there are some schools, but they're probably not to the caliber of some of the other schools, it's sad to say. And so therefore we realized that if that's the zip code you live in and don't have transportation to get out, then that's all you can give your children. But I think instead of us trying to move out of the zip code, I think we just need to say, let's better the zip code. Let's better our own neighborhoods. Let us all come back home. That's going to be my new slogan.
Let's all come back home. And that's what we're saying today, is that we're empowering ourselves as Black women to come back home and work with other sisters to make a difference in our lives.
Yes.
Dr. Woods, I want to thank you for your time.
Thank you.
Nice to talk to you.
Nice talking to you.